knee pain, it can be there for a number of reasons, but in this little section, we're kind of going to address the knee itself. But I really encourage you to look above and below, because how our body tends to compensate is our pelvis loses stability, our hips lose range of motion, our knees lose stability, our ankles lose range of motion, and our feet lose stability. So if you have pain in your knees, chances are you're going to have some of the other stuff. Good news is if you change one, you will change the other. But I want to kind of dive into the knee itself, and common things that I see that will make a big difference in knee pain is how your knee tracks. And then it's also a joint that we don't tend to look at that much. So if you think about your knee, right, and this is your lower leg and this is your upper leg, what happens when you have some sort of problem in your knee, and that can be like muscle imbalances, it can be you injured it in the past, it could be, subconscious favoring. What happens is your hamstrings tend to go on guard. So what typically happens is as you bend your knee, this joint kind of slides like this. Okay, so what happens when you get some sort of problem going on with your knee, your hamstrings tend to guard, so try to protect your knee. And what happens is in that guarding, the lower leg tends to sit a little bit lower, and then when you go to bend your knee, you're kind of sitting out of that track, which actually creates either tension in your quads, pain in your kneecaps when you're kneeling. You can get calf cramps, you can get foot pain. It really depends. It can hurt your bum. You can get like hamstring problems. But the main thing is we want to educate your knee to track back where it belongs. Because when your hamstring is a garter, what happens is it kind of loses its function of how to bend your knee because it's so tight and not really aware of what it should do. Then what happens is your calf starts to want to be your knee bender. So when you go to bend your knee, you're actually trying to use your calf, but that actually doesn't change the fact that when you point your ankle, your calf has to do that motion. So it's kind of like a big mismatch of problems. So what we're going to address here is how to get your knee tracking properly so that you can bring better function to your hamstring, which actually protects your knee or actually makes your knee feel better rather than guarding and protecting. And it also helps how that hamstring attached onto the pelvis. But then I also want to address your fibular joint. So your fibular joint is another joint in your knee that's kind of right here. So what happens is when that knee tracks funny, you tend to get all sorts of junk and clump in and around that area. So what we're also going to look at is how that joint moves or doesn't move. So what will happen is it can move kind of like the roundabout route, which creates a lot of havoc through IT band and your hamstrings again, because that's an attachment point for some of the muscles along the outside of your leg. So really this section is we're going to look at hamstring and how your knee is tracking, but then we're also going to look at that fibular joint. But I also do encourage, because chances are if you have knee problems, you're going to have some sort of restriction and dysfunction in your hip and pelvis and also in your foot and ankle.